Okay, so for my project, I chose joint fusion, and I'm going to be performing it on the first metatarsal phalangeal. The first metatarsal phalangeal arthritis is a surgery designed to treat severe arthritis. Joint fusion is also known as arthrodesis. The purpose of joint fusion is to hold a joint in a fixed position, therefore allowing the bone to grow across the fusion. This means that the joint will never be able to bend again, but it offers extreme pain relief for that area. To start off, the surgery begins with the release of soft tissues that are surrounded by the joint. So in this clip, I'm just using the knife to cut open in order to perform the surgery. Now I'm just going to explain my model before I perform the surgery. So these are the two bones that are made to represent the first metatarsal phalange, and there's a tendon going in between these two bones, and it's known as the extensor hallucis tendon, and it's connected to our leg as well. Also on like here, like in the middle kind of, but for like the purpose of the model, I was able to only put it here. But these are known as the sesamoid bones, and they're on the two sides here. But I'm gonna be performing the surgery like not on the tendon, but next to it. This ligament is made to represent the deep transverse metatarsal ligaments, which is basically in between all of your toes. And so yeah, this was made to represent it because it goes across like between all your toes. And then right here, I also put another ligament, and this ligament is known as the plantar ligaments, which is in between the sesamoid bones. So that's why it's like right here, because it's meant to be in between both of these bones. Okay, so on this side, this is like between both of the tendons. So this tendon is all one, which I already explained what tendon that was. And then on the side, I'm only flipping this for the purpose to show the tendons, I'm sorry. And this is known as the tibialis anterior tendon, which is like on the side. And yeah, it's only connected, this one is, only like at the top of this, it doesn't go to this bone, only this bone. And then also there is a tendon on both of the sides, which is known as the abductor hallucis tendon, which is also, there's one here and there's one on the other side, which is also labeled. And then yeah, so that's all for introducing my model, and now I'm going to start performing the surgery. After a guide wire is then drilled into the center of the first metatarsal shaft. So this one I'm going to poke. So then I'm going to put a guide wire here. So I'm going to poke a hole there. So I'm just gonna lift it a little bit, and then placed over the wire, and the end of the bone is removed. So I'm just going to like use this, pretend to cut it off. So after it's cut, this end of the bone is removed, and then the bone gets reshaped using a circular reamer, which is placed over the wire, and the end of the bone gets reshaped. So I'm just going to use this to demonstrate the bone getting reshaped. In reality, it's actually a circular, so I'm going to use this to imitate the circular reamer and the bone getting reshaped. After the bone gets reshaped, a lot of cartilage usually begins to come out, and so in this video I'm removing the cartilage, which I used pipe streamers to represent. the cartilage. The guide wire is then removed, which was placed here. I am then going to drill a hole onto the other side as well and place a guide wire there. After the cartilage is removed, the shape of a bone cutter is then placed over the wire at the end of the bone. Okay, so a bone cutter is then placed over the wire and the end of the bone is removed, so I'm going to do the same thing with this one. I'm going to pretend to use this to cut it. And for the sake of this video, we're going to pretend that I just removed that. Okay, so after the bone is reshaped, there is going to be cartilage. So in this clip, I'm just removing the cartilage from the bone. The shape of the bone cutter allows the bones to fit together tightly, so now they're tight. A plate is then placed on top of the bone across the joint. A plate is then placed on top of the bone across the joint, and it looks something like this. It has 2 holes here, 1 hole here, 1 hole here, and 2 holes here. The holes are a little small, but yeah. Okay. A drill is then used to create holes in each bone on the side of the joint. So then I'm going to pretend to drill a hole onto here, a hole here, a hole here, a hole here, a hole here, and a hole here. Then a depth gauge is used to determine the length of the screw. So after this, I'm going to use this to measure the length of the screw. Screws are turned down to loosely turn down the plate. So now I'm going to just screw it in a little bit. The guide wires are then removed. So the wires that used to be poking out are removed. So for example, the ones that were here, I'm just going to pretend to remove them. Another wire is then inserted across the joint. So the wire is inserted here, so I'm going to pretend to insert it here. A tunnel is drilled over the wire and a screw is measured and inserted across the joint to add stability. I'm going to pretend to drill over the wire, so like that, and a screw is measured and inserted across the joint to add instability. So there's a screw that I'm pretty sure goes here, and it's just to add stability. It's in the middle in between both joints. Once a screw is in place, the screws on top are tightened. So once the screw is placed, the screws on top are tightened. So earlier we just tied them loosely just so it could stay in place. Meanwhile, and now we're going to screw them tightly, and we're gonna tightly fix the plate to the bone. So additional screws are then placed to fill in blank holes. So if there's any more if it doesn't feel stable enough, you can always insert more screws. And so like there's a screw in the middle, but you can put one here or here if needed. So I'm going to just add an additional one just to make it more stable. After that, we are going to stitch it up. Okay, so everything should be tightly in place, and I am going to stitch it up. And just so it's more visible, I'm going to use red yarn. Close after that. I'm just going to close it up now. So I'm just going to cut the rest of the yarn. And now I'm going to talk about post-aftercare, like life after a joint fusion on your first metatarsal phalange. Post-op care after first metatarsal joint fusion. So arrange for someone to take you home. Do not remove any bandage wrapped around the surgery or any stitches. Your surgeon will do that for you after a certain amount of time. If it becomes loose after it's wrapped, you can wrap it a little more tightly. If it feels tight, you may adjust it. After the surgery, you will need to wear a post-operative shoe that is prescribed to you. You're gonna need to wear it for at least 3 to 6 weeks. This will help protect your foot and keep your bone in the right position. You should also put weight on your foot in order for it to heal faster, but not in the... It can take up to 4 to 6 weeks to get back to doing simple activities, but after 6 months it will heal completely and you should be able to do normal things such as sports, running, walking. Everything should be back to normal after 6 months. Activities. Most patients use crutches for at least 6 weeks after the surgery. If you feel tired or you are in an intense amount of pain, you should rest. After a few weeks, depending on you, you may return back to work, also depending on your job. It may be different if it's labor. Avoid heavy lifting for 3 to 8 weeks after surgery. You may need to do rehab to straighten your foot and improve your movement, such as physical therapy. From weeks 0 to 6, you will not be allowed to put weight through the front of the foot. You will need crutches to walk. You can do daily ankle motion exercises to prevent stiffness, moving the ankle up, such as moving the ankle up and down and making circles. Week 2, you will have a follow-up appointment with your surgeon. Some patients will start wearing a bunion, night splint, and using a toe spacer at this time. Week 6 to 8, most patients begin to put weight through the foot while wearing a post-operative shoe. Physiotherapy will be started if your surgeon feels that it is needed. Week 6 to 12, you can continue to put more weight through the foot while wearing your post-operative shoe. It should not be removed. You will gradually begin walking longer distances and wearing a regular shoe after a gradual amount of time. Patients who have bunion split continue to wear splint at night. Weeks 12 to 26, you should gradually increase activity or see that your activity is increasing. Expect some pain and stiffness that will decrease over time and increases with activity. Most of the recovery will be within the first 6 months of surgery. Swelling, expect quite a lot of swelling for a few weeks. So the recovery will happen in the first 6 months of surgery. Swelling, expect quite a lot of swelling for a few weeks after the surgery. This is normal. The toes often swell up. Elevate the foot to the level of the heart for the first 48 hours after surgery to try to lessen the swelling. Diet, you should start with clear fluids and eat a normal diet. If your stomach is upset, low-fat foods are recommended in general. So you should eat stuff such as rice and boiled chicken. Drink plenty of water, and bowel movements may not be regular after surgery, so you may want to see your surgeon. Medicine, you may have to take pain medication if recommended by a doctor, and over-the-counter medications such as Tylenol or ibuprofen must be approved by your doctor first. It is very common for a lot of patients to have numbness in the toes after foot surgery. Most commonly, this numbness is over the inside of the big toe or on the outside of the big toe. Usually the numbness gets better over months but may never go away completely. Most patients are not bothered by it long term. In the numbness, if the numbness is increasing or numbness and pain are increasing, elevate the foot and loosen the tensor. Icing can also be offer great pain relief. You can apply ice packs or use cryotherapy to reduce pain and swelling. You should apply ice for 10 to 20 minutes 4 to 6 times a day, but never apply ice directly to the skin. Driving. Do not drive while taking pain medications before discussing it with your surgeon. You should also discuss with your surgeon when it is safe for you to drive. If your right foot was operated on, or if you drive a manual vehicle, you will not be safe to drive for at least 2 to 3 months. If your ability to safely drive is impaired, your insurance may not be valid in case of an accident.